All right, welcome back, everybody, to the ROI Online Podcast. And today we're starting a little series of podcasts. I've envisioned and I've been wanting to do this, and so Dr. Kris Wusterhausen has agreed to be one of our initial persons to follow in. I'm going to start this over here.
Okay.
Welcome back, everybody, to the ROI Online Podcast. And I'm excited today because this is the initial in a series of great conversations with Dr. Kris Wusterhausen. Dr. Kris is a board-certified family practice physician. He's certified in age management medicine. He's the founder of the Resurge Clinic in Weatherford, Texas, and he's passionate about his patients. And this conversation, these series of conversations are going to be surrounding around peptides, and more specifically, how physicians should be considering carrying these and utilizing them in their practice. Dr. Kris, welcome to the ROI Online Podcast.
Hi, Steve. How are you doing today?
I'm excited, and thank you so much for being here. So let's just kind of start from the beginning. The intent of this podcast was to have a non-practitioner ask you and kind of bring stupid questions to this conversation to help people kind of get excited about this type of medicine that can really impact their medicine beyond maybe what they've ever considered before. So tell us a little about peptides. What's the scoop here, and why is this such a big deal?
Well, first of all, I think the definition of a peptide is important because a lot of people have heard of peptides, but they're not quite sure what it really means. And first of all, we have over 7,000 naturally occurring peptides in our body. Peptides are simply chained amino acids in a certain sequence that produce a certain function. The government definition of a peptide is 43 or amino acids or under in a chained event. So again, many of the peptides that we use are bioidentical or naturally occurring. They're in our body already. Scientists have been able to isolate these peptides, reproduce these peptides, and so that we can augment certain functions in the body. Because just like hormones, and as hormones go down as we age after, 30, 35, for most of us, so do peptides. It's the same exact action. Our bodies were really kind of meant early on to live, reproduce, and die. That's kind of how we're set up with, thank God with modern medicine, we get to live a little bit longer than that for most of us. Lifespans are expanding, but hormones and peptides do not with that lifespan. And so there are just so many different peptides that do so many different things that physicians have access to.
So physicians are traditionally, there's these borders that the insurance companies kind of draw where a lot of physicians aren't necessarily allowed to color outside of those lines, or at least that's my perspective, right? And so there's certain applications of medicines or therapies that your traditional, just general practitioner wouldn't really suggest because your insurance may not allow it, or you need to go through a certain set of processes. Am I wrong?
No, I think you're right about that, but I do think there's a growing number of physicians, providers in America that are bucking the trend. I've always, actually, a brilliant physician I heard say the other day that insurance, basically you work for the insurance company, you don't work for your patients. You do what the insurance will allow you to do for your patients. I'm very lucky, and most providers would be if they simply asked. so many more patients are willing to go outside of those lines. They don't want to be bound to just what their insurance will pay for. Is this something that's for every single patient? Absolutely not. But one thing I tell doctors, because it's one thing that I do, is talk to doctors about peptides. And these will be doctors many times that have never heard of this before. They're familiar with the term peptide, but they had no idea they could actually prescribe peptides. And, you know, we use peptides in traditional medicine all the time. One of the most popular diabetes medicines today is a product called liraglutide. Its brand name is Victoza. It's a peptide. Uh, so there are traditional medicines. Many peptides that we use have FDA indications. We're just simply thinking outside the box, looking at the how a peptide functions, actually putting on our medical cap and saying, okay, if I augment this function, this event will happen, which is a positive event, because most of us who are deeply entrenched in peptide therapy believe everything is about the cellular function. It's like going back to the ABCs. And if your cells communicate properly, if they work properly, guess what happens? You get healthier, you do better. Peptides are so much safer across the board, in my opinion, than most traditional medications. So my practice, I do primarily deal with cash pay patients, but it's a very quickly growing segment of the population who are wanting, not just willing, but wanting to get away from their insurance company, pay cash, feel like they're getting the best product they can, realizing the insurance is there more as a backup for some people than the front line for their care. So, and I am firmly in the belief that this population will do nothing but explode over the next few years.
I think about it from my perspective. I have an age management physician, and I feel better about my options and the time that he takes to go through my labs and go deeper than what your traditional GP would do, because they're overwhelmed.
Because
They're
they don't have
trying
the
to,
time.
yeah, and so I feel, I'm probably in that age group that these peptides would be good. But I feel like I have more options than I used to. I used to hear, "Hey, just keep doing what you're doing." And
Mhm.
I'm like, "Do you really know what I'm doing?" Or
Well, I had this discussion with a couple patients earlier today, and coming back a little bit to COVID, right now with COVID, there's so much out there about this perfectly healthy person that succumbed to COVID. And by no means am I not trying to say that perfectly healthy people haven't died from COVID, but there's this perception that because my doctor looked at some extremely basic labs, my cholesterol panel, my thyroid, my kidney, my liver, my blood sugars, and said they were normal, that I'm perfectly healthy. And that's simply not the truth. I and other doctors who do what I do advanced panels every day, and rarely does it ever come back perfect. All of us, the biggest disease that we all have is called aging.
yeah.
And whether we like it or not, we're all aging. And the cool thing with peptides is I always joke when I went into age management, it was called anti-aging. Well, we soon learned there is no such thing as anti-aging, but what we can do is manage that aging process and keep people healthier, uh, better quality. And peptides are simply another huge tool in our tool bag to do that.
So let's pretend I'm a general practitioner. I'm kind of exhausted with my practice. I don't see how I'm going to scale it, or what's the length of time can I practice medicine with enthusiasm? What options does this offer me to consider if I start to complement what I do with the peptide
Well,
management?
well, I think that so many physicians today are and I was there at one point in my life. They are so fearful of venturing off the traditional path. They're so fearful that their patients are all going to go away. They're going to wake up in 6 months, have no patients, no money in their bank account, and their life is over as a physician. And I felt that way at one point in my career as well. I did a very slow transition. Heck, I'm still transitioning with my practice, and I would tell other doctors maybe don't transition as slowly as I did, but I had little kids. I was just getting my practice really started. I was about 8 years into my practice, but I realized that I looked up one day. I was 35 years old. I'm now 48. I was 35% body fat. I was hyperlipidemic. I was hypertensive. My blood sugars were trending up. And I realized that if I kept my life the same way it was, that I would probably be dead by 60. And the job was literally killing me. Hats off to all the PCPs out there and the job that they do. It's a tremendous amount of stress. You have to see 35 plus patients a day. When your day is over, you've got to spend 2 or 3 hours doing paperwork many days, just trying to get things approved that you feel like your patients need. And I just realized I couldn't do it. And so when I talk to physicians now, I just try to encourage them that there is another way to do things. And you can, integrate peptides into your practice, still do traditional medicine. It's possible. You just have to talk to your patients in a different way. But the biggest thing I tell doctors to do, or let's say providers, because it might be a nurse practitioner, a PA, a doctor, is, learn about 2 or 3 of maybe the top peptides, get comfortable with them, and start treating a handful of people that are close to you, that you're not fearful of they're going to sue me or something of that nature, and then watch the results come. And as you see them come, you will become very comfortable with these things, and then you can start prescribing them to more people. And it won't take probably more than a year, year and a half till, my gosh, now I'm comfortable. I was talking earlier about how earlier today, how I've taken on training physicians with peptides. And, it's one thing I talk over and over about is just get comfortable with 2 peptides. Let's pick the 2 peptides for your practice that work. And it's different for every practice. And then let's just get really comfortable for 6 to 9 months. And, of course, I'm always encouraging them to slowly transition over to more of a concierge cash model. I think the last time I checked, there's like 40,000 doctors in America now doing this and growing every day. It's just like I was, my car dealership. Like now you can pay a little more if you want to and have the concierge service when you go in, and people buy these things. People work hard and they're okay with spending a little more money to get something they feel value for. And I think there is something to someone actually paying for a service that somewhat more legitimizes that service for them versus I went in and paid my $15 copay with Blue Cross Blue Shield versus, hey doc, I paid you, $1,500 for doing this for me over a few months, but my gosh, I saw the results. And when I spend an hour talking about a patient's labs with them versus what I used to do 5 to 7 minutes, I think it makes a big difference.
Wow. So let's start talking about where, if I was going to walk into it slowly, like you're talking about, what kind of patient would I want to start? And what's the age range? Where are they in their life? What are they thinking? Who would be perfect to start testing or walking into it slowly?
So the good news is you can treat any age, but most physicians are going to be a little more uncomfortable with the extremes of age. They're going to be uncomfortable with kids, and they're probably going to be uncomfortable with the elderly, because if something goes wrong just because it was going to happen, they're afraid. Oh, and pregnancy. Those are probably the areas that most physicians would want to avoid in the beginning. And so I tell most of my patients to look for those health conscious, 35 to 65-year-old range is probably where I would tell them to look at. But more importantly, look at your patients, who get to know your patients. what are their goals? Like the biggest thing when I walk into a room that I like to say, especially with a new patient, is what's your goals for your health? Um, Now, in a cash practice, you tend to have more health conscious patients. You know, if someone's going to pay $2,000 or $3,000 a year to see you, they're more likely to be invested in their health. Not always, but most of the time. And so many times they're like, you know what, I'm wanting to get my blood pressure down. I'm wanting to lose 8 pounds of body fat. I run. I want to increase my, you know, minutes per mile by 30 seconds, whatever it is. And so I will then look at my labs and determine what things I'm concerned about and hopefully mold into what they're concerned about and come up with a plan for them.
So let's talk about like the top two peptides that you would start to consider and why. Or,
Okay.
or before we do that, you know, I'm looking at this information that you sent me, and when we're talking about, you have your strengths, your opportunities, the you know, it's good efficacy, safety, tolerability. Can you kind of talk about those specifics first?
Yeah. So I've been using peptides in my practice now for about, I was trying to think about this the other day, at least 5 years, maybe pushing 6 years.
Wow.
And the adverse events in my practice from peptides has been practically nil. The worst thing that has happened with a peptide in my practice is an allergic reaction. Two patients, hives. One happens to be my wife. And so,
You're
so
still hearing about that one, aren't you? Yeah.
well, yeah, because she's upset that she got the hives because she was having great success. But so both treated with little Benadryl and stopped that particular peptide, and we just never went back to it, and life is good. So, you know, again, most of these peptides are naturally occurring in the body, and when you're doing more bioidentical things with the body, chances of adverse events, in my opinion, go way down versus starting Lexapro, which I've done many times. So I'm not knocking that medication. It's a good medication, but you know, last time I checked, we don't make Lexapro in our body, and so you can imagine that you know there's a lot more side effects: nausea, weight gain, just not feeling good, allergic reaction. Those are all potential effects. So when you get into peptides, just it's probably the number one thing I try to teach my providers is don't be scared. They're safe. They're so safe. I feel much safer starting a peptide than I do starting an antibiotic in my
Wow.
patients. And that's how comfortable I feel with writing peptides or prescribing peptides to my patients.
So what's the difference in between a steroid and a peptide? I mean, what would you consider a peptide in certain applications that you might consider a steroid?
So it depends when you say the definition of steroid, what you mean. I mean, you know, we have anabolic steroids. We have steroids like prednisone, okay?
Mm-hmm.
And prednisone, of course, and prednisone-like products are anti-inflammatories. We use them in different inflammatory type situations in the body like arthritis, possibly even infections like COVID, asthma, things of that nature. Then you have your anabolic steroids, which are basically down the hormone pathway. They're basically, you know, inducing muscle hypertrophy and some metabolic issues. Most of us believe that down the road they have a severe potential for heart disease, cardiomegaly with the heart, liver disease, things of that nature. Peptides, going back to them, they're simply chain amino acids, enzymatic type products that are already in our body, naturally occurring every day. And so that's kind of what I would say is kind of the major difference. But that's a good question. I never really thought about it like that.
What made me think about it is when you talked about antibiotics, and you know the general population is aware that we're growing a resistance to antibiotics in many ways, and it feels like we're running out of options. And I was interested when you said that, what application would a peptide, if you went first with that and it worked, then you would be resolving the resistance. issue as well.
So yeah, because you're using the body to fix itself. And, you know, by no means would I tell a provider you got someone in septic shock not to use an antibiotic. Okay.
Right.
So I'm always very, very clear about that. I like to tell other physicians and patients, I'm a traditional physician that molds in alternative medicines. I don't feel like I'm traditional doctor. I don't feel like I'm alternative doctor. I think we should use all modalities that we have at our fingertips. But like, just for an example, there's a great a peptide called LL37 that we make LL37. It's an antimicrobial peptide that can fight bacteria, fungus, viruses. Has had some multiple doctors across the country have been having really good success with that peptide in active COVID infections. And it's just a more natural way of treating the body. And so the peptides are practically endless right now. I mean, there's so many in the pipeline. There's about, I think the last time I read, there was maybe 60 or so active peptides that we're prescribing at the moment. Most physicians or providers use 5 to 10 different peptides in their practice because there's different peptides for different specialties. But yeah, that's, you know, the antibiotic resistance that we have today in our world is created by doctors, providers. You know, unfortunately, and Lord knows I've done it, so I can't claim to be not part of the problem. But the patient comes in and you say, "Hey, Steve, I really believe this is viral. You don't need an antibiotic today." And then the response is, "No, doc, you know, every time I get this, I have to have this antibiotic or I get worse. And, you know, I can't miss work." And you get put in this awkward situation where, you know, after a few years, you just give in, unfortunately, and say, "Here, take this Z-Pack." And I just added to the antibiotic resistance of America, of the world. And so, but, you know, you just sometimes lose the battle when it's 6 o'clock at night and you've seen 35 patients and you're just like, you know what, I don't want to fight about this here. And every physician has done it. I don't care what they say. Doesn't make it right, but we've all done it.
So is this something that requires the physician to inject it, or is this something that can be taken orally? Is it one time and then you're good for a month?
So most peptides are injected, subcutaneous insulin syringe. It's an injection that if I had you, you know, turn your head and talk to somebody and I poked you with it, you might not even know I did it. So there's no pain. I hear physicians say I could never get my patient to inject something. And I've never had that problem, to be honest with you. I pull the needle out and I show them and I go, "Really, you're scared of this needle? I mean, this little tiny needle?" And, you know, I just kind of guilt them into it of feeling like a weenie if they don't do it. And it works. It works every time. But they do make peptides orally, nasally. Um, uh, there's even some that are transdermal, but the vast majority are subcutaneous injections.
So the physician would hand them to me, show me how to inject them, and then I would leave. Is that a daily thing? Is it
Oh yeah, sorry, I didn't answer that part of the
Yeah.
question. So different peptides, different things. I have different protocols depending on what the patient's goal is, but many of my peptides, so one of the big things I treat is what I call cell senescence in my practice. And so going back to that cellular level, um, there are a few different cellular functions. One is like called apoptosis, which is basically a cell that realizes it's not doing well and it commits suicide and it's gone. We have cell autophagy, which is basically the repairing of cells. And then we have, as we age, especially some of these cells that the term I was always taught, these cells kind of become zombie-like. They don't do their function anymore, but they don't go through apoptosis, cell suicide. They hang out. And bad things typically occur with those cells. And many docs theorize or scientists theorize those are eventually what become malignant cells, put you at higher risk for chronic diseases like diabetes and hypertension and things of that nature. And so we have certain peptides that we use to work on different parts of the cell cycle to repair the cellular function, but doing it in different phases of the cell cycle so that we slow down cell senescence, repair cell senescence before it becomes final. And so a lot of what we do here at our office with peptides is simply what we call cell senescence and treating cell senescence. This is your 45, 50-year-old guy or girl who wants to be as healthy as possible, who wants to slow down aging as much as possible. And many times those type patients can take 3, 4, 5 different peptides. One of my particular protocols, I have one that they inject at night, 5 nights a week. They take Saturday, Sunday off. In that protocol is another peptide called rapamycin that they take 1 pill on the weekend. Then I do TA1, which you had asked me my top 2 peptides, probably the one we'll talk about. We do it a couple of times a week to modulate the immune system. And then possibly something like BPC, which is oral, and they would take that once or twice a day. And then I may do that for a few months and then decide to change up the protocol. I am a big fan. How I was taught is to kind of always adapt to that, keep the body guessing a little bit and change it up a little bit. But, you know, kind of going down that path of my 2 favorite peptides, my 2 favorite peptides, if I could only pick 2, you know, that old thing, if you're going to go to a desert island, it's a growth hormone secretagogue and thymosin alpha 1. Those are my 2 favorite peptides. Thymosin alpha 1 is created in our body, and our thymus gland has multiple FDA indications, but what it does is it modulates the immune system. And I used to say this wrong until I heard a brilliant physician speak about this. We're not increasing the immune system, we're modulating the immune system. We don't necessarily want to just upregulate our immune system and have it attack everything. That's not necessarily good. Modulating to me means that we're going to simply make it work at its best point that we can, so that when it comes in contact with things that it shouldn't be in contact with, it knows what to do. And our immune system, and our sometimes poor immune system, has so many negative effects on our body. So many people walking around with gut issues, you know, my belly just doesn't feel good. I've got irritable bowel type symptoms, when simply what that really is just cell senescence. Their body just isn't performing well. And with a little bit of dietary changes and some peptides, you can get a person functioning much better. Growth hormone secretagogues basically work on the anterior pituitary gland to increase growth hormone secretion and production. And I'm always very clear to providers, this is not growth hormone. Growth hormone, I'm not a fan of. Very difficult to legally prescribe in America. There are side effects to growth hormone, but we basically have the body mimic the production and release of growth hormone that we had when maybe we're in our 20s, but now we're in our 50s. You know, there was a trial, a study that came out a couple of years ago called I think it was 2 years ago, called the TRIM study. And what they did is they took patients, it wasn't a big study, it was like 10 or 15 patients. They put them on growth hormone, metformin, and DHEA for 6 months. They tested on pre and post, so 6 months apart, for their biologic age, okay? We now have tests that give us very accurate levels of your biologic age. They reversed their biologic age in 6 months on an average of 2 years and 6 months, which is amazing.
Wow.
Now, that was with growth hormone. The problem, in my opinion, with this study is that they picked the wrong product. Should have been a growth hormone secretagogue, not growth hormone. The reason they had to put metformin and DHEA on board is because growth hormone causes insulin resistance, which leads to diabetes. So they were using the metformin and the DHEA to counteract the side effects of the growth hormone. Which, if you'd have used CJ apomorelin, a growth hormone secretagogue, you do not have an increased risk of insulin resistance. It actually combats it. So anyway, but that's my point, is that, you know, you can, the really cool thing now is you can actually do advanced testing on patients, show their biologic age, do some of these practices with your patients for, I recommend 1 year, and then in a year retest them and see how a person actually got younger over a year. I mean, how amazing is that to get younger? I mean, that's just not something that happens at our age typically.
Well, not only are you going to get younger, but you're going to, I would assume, you're going to have more energy. You're going to, what are some of the things that are reported back to you that folks experience after this sets in after a month or so?
So just generally, I feel better. Most of my patients are active exercisers, and so they really come back and tell me like, "Oh my God, this is like what it was 10 or 12 years ago when I went to the gym. I'm actually seeing
Wow.
my waistline go down. I'm actually seeing my muscle mass go up. All these things. I have energy to go to the gym. I feel like going to the gym. Sexual function typically improves. Just life in general improves. I just say general wellness improves. People come in and they're smiling, they're happy, they feel just so much better. It's so. But then I love the fact that then not only do they have those subjective feelings, but then I can give them objective data on, like their biologic age. So, sometimes people think, do I really feel better? Is it just
Yeah.
placebo? Because I bought into this so much. But then when you can actually show them your age has changed this much, or you've just halted their aging, whichever it is, it can really get people to buy into this program. Patients, that is, and doctors actually. When doctors see that, because I guarantee there was nothing I was doing in my traditional family practice, 10 years ago that I felt like was slowing aging down to this point. We're all going to still age. It's just we're slowing this process down. We're having people live healthier and better. And I think just the thing that you're looking for is just what my patients are looking for, which is just health, quality of health, feeling good, and feeling like they're buying into an actual program that they can get behind.
Seems like it would be more, if the reason you wanted to be in medicine was to help people, help heal people, this feels very congruent with that, that you would actually be creating ways that you can be more effective based on the frustration you might feel as a general practitioner coloring inside the insurance mandated yeah, processes.
If I hadn't found age measurement medicine, functional medicine, whichever term we want to put on it, I'm not so sure at this point in my career I'd still be practicing medicine. I, after 3 years of 4 years of medical school, 3 years of residency, 10 to 12 years of traditional practice, I had just about had enough. And this has saved my career. I think it's my calling. I love coming into the office and seeing my patients. And I love family practice as well. By no means am I here to say I hated it. I hated the system is what I hated.
Yeah.
I just despised it. I despised working for the insurance companies in these settings and clinics. But thank God for the people that do it. But now I feel more like a healer than I did 7, 8 years ago, simply by saying, Steve, here's your blood pressure medicine. Here's your diabetes medicine. I always say it was another pill, another pill, another pill. Never looking at, why is this person continuing to get sicker and sicker? Like, how could I help that process? I feel like traditional medicine today is just a reactive thing. Like, oh, Steve's got high blood pressure, put him on blood pressure medicine. Well, maybe so, but how about we talk to Steve about how to get off the blood pressure medicines? What are some things we can do to fix his diabetes or fix his high blood pressure? Everything doesn't have to be wrapped into a statin, an ACE inhibitor, or a diabetic medicine, in my opinion.
Mm. All right. Well, excellent. I think this is a great place to stop here for this first conversation. So if I'm a physician and I've been listening and maybe this has been in the back of my mind, or maybe this is something I want to consider, what should I do next to reach out to you or connect with you?
Yeah, certainly happy to talk to any physician about this and work with them on trying to guide them in the proper way. They can certainly contact me at my email or through my website. theresurgeclinic.com. My email is Dr. Kris with a K at theresurgeclinic.com. I respond to any provider that reaches out to me. Talk to them about what we're doing. I love to share the knowledge and would be more than happy to speak with anyone.
All right. And so in our next series, we didn't really decide on this before we started, but what are you feeling might be the topic that we want to cover on the next conversation?
I think it would be good maybe just to really concentrate on how to some of the top two or three peptides and how we could actually use those in our practice and what they do and how they do it. I think would be instead of just giving little 10-15 second snippets, maybe go a little bit more into two or three of the top peptides for any providers out there or patients to have a better understanding of how it works. Because when I actually, and I did couple consults last week with physicians as patients, and I talked to them just like I talked to a patient, because most of my physicians, and Lord knows I was in this position, don't know any more about peptides than the patient does. Uh, the cellular function that we learned in medical school or in biology has many years ago passed us, and Lord knows I still today, every week, read about the cell cycle and just the whole process, because it's a very complex. And I find if I don't read about it every week, I start to lose it. And so, anyway, I think that it would be beneficial to kind of start talking a little bit more in depth about some of these peptides.
Okay, we'll be starting to collect and get those resources set aside and start being able to direct folks to where they can learn more about those as well. So, Dr. Kris, thank you so much for being on the ROI Online podcast. I look forward to our next conversation.
Thanks, Steve.